script for Mr. Kosowitz.
Yep.
Hi, how are you today?
Good, and you?
Yeah, good, thanks. Now I've got a script here for Spiriva, and I believe you haven't used this before, have you?
No, I haven't used it.
You just want to have a seat and I'll go through it to use
Yeah,
it.
sure thing.
Okay, so that's the actual medication box. I've got a placebo here, which I'll show you how to use. Yeah. Okay, now before we start, are you allergic to any medication?
No, not that I know.
No? Okay. Now, do you know what you're using this for?
Yeah, it's for my breathing or something.
Yeah. So it's for your chronic obstructive pulmonary disease.
Yeah, that's one.
Yeah. So that's where you can't breathe properly. And so what this medication does is, the brand name is Spiriva, and what it contains is tiotropium. And this medication, what it does is it relaxes your airways so that you can breathe better. Now, it comes in two parts. There's the capsules and there's the Handihaler. And I'll show you how to use that. So what you do is, you open this dust cover, and that's the mouthpiece there. And then with the capsules, they come in a strip of 5 capsules. Now, you must make sure that when you're going to use it, just take out the capsule just before you're going to use it. So don't open it and keep it ready before that. And the other thing is that once the capsules come in strips of 5 capsules, so once you start using this strip, you make sure that you use all 5 within the next 5 days. And okay, so that's the mouthpiece there, and you can flip that over, and that's where the capsule goes in.
Yeah.
I've got a sample one here, and you just drop the capsule into the center chamber there, and then you close the mouthpiece again until you hear a click, and then you push the green button in fully until you actually hear the capsule being punctured.
Yeah, that crunch.
Yeah, the crunchy sort of sound. And then what you do is you breathe away and fully exhale, and then you sit upright and close your lips on the mouthpiece and breathe in fully, and then hold your breath and pull out the mouthpiece, and then hold your breath for as long as comfortable, and then slowly exhale out, and then repeat this once more so that you make sure that you've inhaled all the powder in the capsule, and then you can just open the mouthpiece and tip out the used capsule and throw it away. Okay. And also, once a month you should wash this device, and how you do that is just open it up completely, and you can open the base as well. That's by pushing this green button up, and then just run it through warm water, and then air dry it. Don't dry it with a cloth.
Should you soap?
No soap, just warm water. Yeah. And then what I would suggest is that once you've taken your dose for the day, rinse it, and then you can just leave it overnight so that it's dry by the next day. Yeah. Now the doctor has prescribed you're supposed to inhale 1 capsule daily. Now, once you inhale 1 capsule, the effect starts off within 30 minutes, and it's supposed to last a whole day. So it should last you till your next dose. If you do forget to take a dose, then don't take a double dose. But as soon as you remember, you can take it. But if you remember to take a dose just before your next one, then I would suggest you just continue with the next one. Don't take the missed one. Okay, so that's that. And with side effects, you might get like a dry mouth or dry throat, or a bit of cough, or a fast heartbeat. Now, it shouldn't be too bad, but if it worries you, you can call us, or you can talk to your doctor. Now, what you should keep in mind is if you do get any eye pain or blurry vision, then you should talk to your doctor, because it has been reported that in some cases people get glaucoma, and that's not good. That can damage your eyes. The other thing is that sometimes, rarely, you can get an allergic reaction to the medication, and what can happen is you can get shortness of breath, or you can get your lips and your face starts getting puffy, and if that happens, you should rush to your hospital, because that's an emergency. Okay, that's about it. And just store it in a cool, dry place, and don't put it near your shower or your bathroom. That sort of place where it's damp, because that can damage the capsules. Yeah, that's about it.
And then what else can I do to help my breathing?
You should just generally have a healthy lifestyle. Do you smoke?
Yeah, a little bit.
Okay, you should stop, because
Okay.
with COPD, what happens is smoking can actually make it worse.
Yeah.
And so I would just say it's a good idea if you stop smoking. And you can talk to your doctor, or you can come back in, because there's a lot of nicotine replacement therapies, different types like patches and gums, which you can successfully use to quit smoking. And apart from that, just a healthy diet, moderate exercise, like 30 minutes a day,
Yep.
and you should be fine.
Okay, thank you.
Cool. Any other questions?
No.
If you could just sign there.
Yeah.
Thanks. And that's a CMI if you want to have a look
yeah.
at any other thing. Yeah.
Alright,
Thanks.
thank you.